Hi, my name is Julia Ramsey. I'm the YouSpeak Accounts Manager, and today we're going to talk about some common pitfalls you may find yourself dealing with when you draft up questions for a feedback questionnaire. So, if your organization decides to conduct its own satisfaction survey, it's very important to make sure when you write your survey items that you do it in a way that's going to collect good data, that it's not going to get anything that's biased or measures things differently than what you're hoping for. Good questions lead to good data. So that's what we're going to chat about today. In particular, your well written survey question should handle the following. They should ask a specific question. It should only ask one thing at a time. You should avoid assumptions on behalf of the reader and avoid subjective language or leading questions. Finally, you should make sure that all of your survey items are going to be interpreted in the same way by everyone taking the survey. So let's talk a little bit about specificity. You should avoid writing questions that are so general as to yield no useful data at all. So an item here like the service here was good. If it's not the case, then that gets you absolutely nothing specific about how you can fix it. Or I can do what I want to. What on earth does that mean? So, in some situations, you may want to ask overall, the service was good as a summary item, but you also want to include specific follow up items about particular aspects or dimensions of the service experience. And remember, only ask about things that are within your control to change. It's also important that each question only asks one thing at a time. So you want to avoid items that ask two or more questions, but the respondent only gets the choice of one answer for this. In survey language, this is known as a double barreled question. For example, how would you rate the cleanliness and safety of our facility? Or the food was delicious and there was a good variety. So, what would a respondent do if they held different opinions on these two topics? What if the safety of your building is great, but it wasn't very clean? How does someone answer that? And similarly, if someone says they disagree with the item, the facility was clean and safe, did they disagree with both things? Did they disagree about safety or about cleanliness? What do you do with that data? You can't. So it's very important to make sure you're only asking one thing at a time. Some cases we have seen in the wild, and I'm going to have plenty of examples of bad survey questions from the world, try to squeeze a ton of things into one questionnaire. So, what comes closest to your view? There's a lot to unpack here. And if you wanted to ask about these, it would be much better served to break it up into several smaller questions about various things that you're trying to cram into one rateable item here. When you're writing your survey questions, it's also very important to avoid assumptions. And in general, your questions should apply to most all of the respondents who will be taking the survey. For example, a question like, I take my medication every day, may not be appropriate to include, or staff properly processed my insurance claims. So, those questions may be helpful to the people to whom they apply, but how would someone answer if they don't take medication? So, the best way to handle this is by using qualifying questions. Do you take medication? Yes or no? If the answer is yes, how often do you take it? So, that clues the respondent in that they don't need to answer an item about medication if it doesn't apply to them. And you're not going to get people confused who completely give up on participating in your survey because they don't know what you expect of them. If you're using an online survey, we strongly recommend you use skip logic, which allows you to change the items that are presented to the respondent based on previous responses. So here we would ask, do you take medication? Yes or no? And if the answer is yes, then you go on to ask the series of items about how often you take it and how well it works. But if someone does not take medication, you skip that section and go on to the next part of the questionnaire. You may also want to consider an NA or not applicable response in this situation. That again clues your respondents in that they don't have to answer something if it doesn't apply to them. You also want to make sure that all questions are going to apply to everyone. This one, also seen in the wild, I would hope everyone is going to answer no, they have never been in an accident that resulted in your death. Um, Unless you're writing a survey for ghosts, that could happen. But make sure all your questions in this area too are relevant to everyone taking the survey. Leading questions can be another area that gets a little bit tricky when you're writing your survey items. So you should ideally be writing your questions from a neutral standpoint without any implied judgment, particularly when you're in areas that may be a little bit more sensitive, such as drug rehab or working with folks who are in the criminal justice system. So, an obvious example of this is, how great was your rehab experience? And how does someone react if they actually had a really terrible time? Or, my hardworking nurse listened to me. Well, if maybe you had a nurse who was mean to you, but is this going to suggest you shouldn't say anything bad because it's a difficult job and they put in a lot of hours? That introduces complication you don't want to mess with. So, the best thing to do is to use more neutral language in your survey items. Or even, what problems did you have with your visit? That implies that there were problems at all. What if you had a great time and there was no trouble whatsoever? So, in general, if you're asking respondents to agree with a statement, you want to keep it positive, but without loaded language. For example, I agree or disagree with the statement, I feel safe here. Or you agree or disagree with the statement, people here listen to me. Give them the affirmative, positive case to agree with. The staff was respectful, the building was clean, and maintain directionality throughout, which basically means the right answer, in a matter of speaking, should always be the same. So you wouldn't want to jump between the staff was respectful, you'd want to agree, and the building was dirty. The right answer is disagree. That's going to get folks too confused. So ideally, you want to maintain that directionality of having positive responses, but without leading language. Another example, this one was actually taken from the 2018 NRA Gun Owners Action Survey, asked about innocent citizens who are defenseless against terrorists and violent criminals. This is a problematic question. I'm not going to say any more than that, but it's very important to keep your wording neutral. Another area of attention is that your items should be interpreted consistently. Everyone should understand and respond to your question text in the same way, regardless of their experience or participation in your organization. So, if you ask someone, what things do you like to do? Someone might understand that you want to find out which particular rehab activities they like, but somebody else reading this question might say, yeah, I like mountain biking and roller skating, which is not relevant to your outcomes improvement efforts. Similarly, where do you like to go for services? You may intend that for them to tell you which of your clinics they like to go, but then they see this item and say, oh, I like to go to the hair salon on 22nd Street, and completely miss the mark of what you intend. So it's very important to make sure your questions are written to explicitly lay out how they should be understood. Or even something like, when do you like to go? It can be completely up in the air. So you want to avoid ambiguity. And to do that, you want to explain any terminology that may be unclear. Be as specific and clear as you can. And if you need to offer definitions, don't be afraid to do that. A really good practice is to ask 3 people internally on your team, friends or family members, ask them to read the item and share how they understand it. That way, you can get some perspective, even from outside your organization, about how someone might see and respond to this item to make sure that everybody understands it the same way. As you finish developing your items, you also need to consider the rating scale which your respondents will use to answer it. We ideally suggest that you should include all possible responses to an item and include a sufficient number of options to distinguish between degrees of sentiment. So, if you're asking, was the building clean? Yes or no? How does someone answer if, it was okay, but it wasn't sparkling clean? So, by adding an appropriate number of degrees on your scale, you can tease out the appropriate sentiment in response to your prompt. Yes, no is not great. Always, sometimes, never is pretty good. On a scale from 1 to 10 is fabulous, although you do have to consider that too many degrees may cause some difficulty, because what's the objective difference between a 6 and a 7? Mm. Maybe you'd want a 1 through 5 rating scale. It's something that you can think about and may be different depending on the type of question you're asking. But it's very important to consider what's going to be the most appropriate rating scale for the data you're trying to get to. Too many options are going to confuse people and you're not going to get clear data out of it. We also suggest that you use the same rating scale for most items. So, keeping an agree or disagree scale or a 1 through 10 questionnaire scale on all your items is going to be the best. If you switch from a 1 through 5 on some items and then a 1 through 10 on some items, that's going to confuse people. It's going to lead to inconsistent data and it's just going to make things a mess. The Likert scale is my personal preference. This is most commonly used in satisfaction surveys, and it's named after Professor Likert, who was a psychologist working in measurement. So here, the respondent is asked to assess their opinion on a directional scale. For example, the building was clean. Do you strongly disagree, agree, or strongly agree? You can sometimes put these on a pictorial rating scale. We tend to do this a lot with intellectual and developmental disability folks or with children. Point to the face that best matches your response. And you may or you may not want to include a neutral category on here as well. But this tends to be very helpful to summarize because you can lay out the percent positive. In this case, this would be the percentage of agree and strongly agree responses to your particular survey item. And it's an easy way to understand your results. It's also important with these rating scales to avoid potential bias. So the ends of the rating scale should not be super extreme. You want to avoid what's known as central tendency bias, where people don't feel comfortable offering a super extreme opinion. So, if you had a scale, how was your service here? From the worst I've ever had to the best in my life, people are probably not going to feel comfortable saying best ever, and they're going to rate you towards the middle of the scale. When ideally you want to get, yeah, the service was great, but that may not come out in the scores you receive. With some items, you may also run into social desirability bias, which basically means people feel bad about giving particular ratings for one reason or another. An example might be that, the nurses worked hard, but my nurse was mean to me. But because they feel bad, I feel really bad giving them a bad score. This may also come into play with sensitive items. So, asking someone about their level of bias towards certain types of people, for example, folks may not be willing to confess, for lack of a better term, to their true opinions because they're afraid others will be judged. In the healthcare setting, this may apply to situations where if they tell the truth, there's worries that their services may be impacted. So if they say, yes, I've relapsed on drugs, ooh, that's no good, but it may prevent them from getting the help they need and prevent your org from assessing the efficacy of your services. So, social desirability bias is very important to consider in your rating scale. So, this is one that, again, I saw in the wild. How was our service today? Is the worst I ever had through amazeballs? Yeah, somebody used that on a terminology questionnaire. Um, Generally, sticking to more neutral language, agree to disagree, or on a Likert scale, something like poor, fair, good, excellent is a really good rating scale. So keeping it as something like that is going to work out for the best. We also note again, you want to avoid an obvious right answer. So this is going to depend very much on the service area, but something like I have followed my doctor's instructions. Well, hopefully you're a good patient and you followed the patient's instructions, or the doctor's instructions very accurately and all the time. Is someone going to be honest about that, or are they going to tell you what you want to hear? So when you're crafting a rating scale, you may want to take that into consideration. And a situation like that, you may want to include, all the time, almost all the time, which makes you feel less bad as a respondent compared to when I feel like it. And take that into consideration, their perspective possibly as a respondent when you're working on that rating scale. We also see what we call acquiescence bias, which is where you go, yes, 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 just because you want to look like a good patient, or maybe because people are bored and want to be done with your survey. It's also worth noting that we do experience acquiesce bias with developmental disabilities and with children. because if they're not sure, they may want to please their caregivers or the person that they're working with. So they may say yes for lack of any better or more nuanced response. Particularly because, again, they want to make their teacher happy. Or in the case of someone reporting their compliance with discharge instructions, they don't want to get in trouble. So that's something that certainly needs to be considered. It's also very important to make sure that your response options are not super emotionally loaded. So this was another survey that was used in a customer service setting after someone had talked to tech support. How was this conversation? Was it toxic or healthy? That's really loaded. A toxic conversation implies that maybe the person was abusive towards you. There may be other bad things going on. Um, and, how would you respond if they were a nice person, but they weren't very helpful? And how comfortable are you in saying that? So, again, don't be like these people. Make sure to use a more emotionally neutral and less drastic rating scale for your items. It's also important that your scales be balanced, and meaning they have an equal number of positive and negative categories. You want to avoid directional bias, where, for example, if your rating scale is, how was our service today? Was it bad, okay, great, fantastic? You've got more options on the good side, and so you're going to get directional bias towards those positive answers because there's more nuance in that rating scale, and you want to avoid that. So, ideally, you have an even number of categories with a roughly even distance between them. And it's really hard to do when you're looking for, sort of subjective words like, is the distance between terrible and poor the same as the difference between okay and good? It's a little tricky. So, in that case, you may want to default to more of a 4-point scale. You may want to use a numeric rating system where there's obviously one number of difference between your categories in order to make sure that those are spaced out evenly. And this will also benefit in that it allows for meaningful averages. So, if you ask folks on a scale of 1 through 5, 1 being terrible and 5 being excellent, how was your experience here today? And you can come back in your results and say, on average, participants rated their service experience as a 3.8. And that's going to make sense. Whereas it's a little more difficult to give an average to a lopsided rating category. So this example here is a lopsided rating category. You go from angry to neutral to 3 dimensions of smiliness. And dimensions of smiliness is certainly not a statistically valid measurement, but this is something that IKEA tried in a customer service survey, and I would be fairly skeptical of any results that came back out of this tool. The next question when using a rating scale, particularly a Likert scale, is should you have a midpoint, a neutral, or a neither agree nor disagree standpoint? So that would be the difference between a 4-point and a 5-point Likert scale, for example. So, in general, we find that respondents like to have a neutral option in case they don't have strong feelings. And oftentimes, when I use a 4-point scale, there will inevitably some respondents comment, "Oh, there should have been a neutral or does not apply. This rating survey is terrible." Um, but the catch with that is that analysts treat a neutral point data as effectively missing data. It does not tell us anything. We would basically toss it out of the analysis. And so, as an analyst, I prefer to leave out the midpoint because it sort of forces folks to indicate if they lean even 1% towards agreement or disagreement, it's going to tease out that nuance by removing the midpoint. And of course, if someone is truly on the fence and does not have an opinion about an item, they can skip it. So they are not forced to make a choice they're not comfortable with. So neutral responses are essentially missing data. And you do want to encourage them to lean one direction or the other if you can. They can skip the question if they're truly neutral. And of course, you want to make sure that you can quantify your surveys in a way that is meaningful to respondents and gives them the opportunity to express their feelings. In this one, for example, it's smiles, grins, or hearts. What do they do if they're not happy? There's no way for them to express that. It's also important to include all possible responses. So, I am a huge fan of David Attenborough and his BBC Nature documentaries. But this Instagram poll, have you changed your lifestyle since watching this film about nature? Is it yes or I will? What does someone do if they are not planning to change their lifestyle? And hopefully it's because they're already totally green and eco-friendly and they don't need to make any changes. But this is a very leading response because of the options presented. And so please make sure that you are including all possible options to get a full picture of what's in your respondents' minds. It's also important to proofread and use the appropriate scale. So, this is one that was for a local activity group, social group before the pandemic, trying to get people, I think it was a mom's group of moms getting together away from their children. So, what do you want to see during the evening? And the rating scale is like to dislike, which is a complete mismatch. So hopefully that was just a failure to proofread and they actually meant for this to be a comment box. But not only are you not getting the data you want here, they're not actually going to collect any ideas of mom bingo, but it also introduces doubt into the mind of the respondents. Like if they can't be bothered to pay attention to their instrument, how can I know they're going to handle my data with care and use it properly? So please proofread. Similarly, you want to make sure your responses are sorted in a way that's going to prevent the respondent from hunting to give you their opinion. So, are you interested in investing your personal funds? This starts out as maybe a yes, no, and then they threw in some degrees of how interested they are. Um, so, it's out of order, it's not intuitive, it's going to confuse people. And this is another one that really should have been proofread first. Also, make sure to proofread this survey from Roku about their streaming devices. There's 2 6s on this rating scale. That's a bit of a problem, so please make sure to watch out for that as well before you launch your survey. I mean, seriously, proofread. Is your gender male, female, or Venezuela? Oops. Is your sexual orientation? Is it Danish? That's really awkward. And I highlight these in particular because when you're looking at demographics, just as an aside, it's really important that you are expansive and inclusive in the ways that folks may identify. So make sure that you are offering an appropriate number of response categories. We do suggest avoiding the use of the word other because it's othering, in the words of the LGBTQ community. So we would recommend from a analyst best practices recommendation, something like please specify and give folks the opportunity to share the terminology that is most appropriate for them. Also, please make sure that your rating scales are not completely overwhelming. This one is from Bank of America. How close do you feel to Bank of America? Which, to start with, is kind of a weird question because I don't have an intimate relationship with my bank. But we're supposed to interpret these circles and their degree of overlap to closeness and how close. And this is a bad question. Don't write questions like this. They want to keep things simple, straightforward, and easy to understand. So, in closing, you want to make sure that your survey items are simple and easy to understand. We strongly recommend the use of a consistent Likert scale for most of your items. And make sure to test your questionnaire before launching. Ideally, give it to a couple of potential respondents, have somebody on your team or somebody in another department read your questionnaire, and especially checking for typos and other minor errors. And make sure to proof it very thoroughly before you send it out, because once the cow is out of the gate, in a manner of speaking, and you've started your data collection, it's too late to change it. You only get one chance and you don't want to throw away your shot to collect good data. So please handle your questionnaire items and your rating scales with the utmost of care. If you have any other questions about survey design, I am a proud survey nerd and I would be thrilled to chat with you about best practices. Feel free to drop me an email at jramsey@uspeak.org and let's nerd out together about some rating scales. Thanks very much. Thank you for your participation and take care.